We now know from many, many studies of the lap band system that we can obtain sustained weight loss. We know that it takes 2 years to achieve maximal weight loss, maximal average weight loss, which is about 50% of excess weight loss. Here we see in this slide a series of 9 studies and over 5,000 patients, and you'll see that the mean excess weight loss is around 50% at 5 years, and we have good evidence that this is established right out to 10 years. So there's no systemic or systematic weight regain. How do we obtain these results? Well, we obtain these results by careful long-term follow-up. Obesity is a chronic disease, just as diabetes and other diseases are chronic diseases, and we need lifelong follow-up. It's a chronic disease model of care. Let's think about type 2 diabetes now. We have about 7 to 8% of our community with type 2 diabetes. We have well-established multidisciplinary care to look after these patients. We have guidelines, we have targets, we have roles, we have responsibilities. We know that we have an integrated system. We have primary care and community care, we have secondary care, and when necessary, tertiary care. Even with all the work that goes into the multidisciplinary care of a diabetes patient, we still find that we're struggling to reach targets. It's no wonder we struggle with bariatric surgery when we don't have this pre-prescribed infrastructure and all of these guidelines. When we look at some of the compliance issues for our patients, we've got this issue in the United States. Did you know that 50% of the 2 billion prescriptions filled each year are not taking it correctly? A third of patients take their medications all the time, a third occasionally, and a third don't get them even filled out. Studies have shown that non-compliance with therapy leads to about 125,000 deaths in the United States a year. Now, we can extrapolate these to Australia. You know, if a patient doesn't believe in their therapy, why should they take it? Compliance is critical with the lap band. Compliance is important with the lap band experience. We need to have our patients adhere to eating better, choices of food, eating practices need to be improved. We need to do this to prevent complications and to optimize weight loss. We need our patients to understand that they need to comply with increased exercise and physical activity. There are many benefits from this that we well understand, and our patients will appreciate it, but we have to emphasize this. We need to talk to them about compliance, regular follow-up, timely adjustments, additional education for the patient, and support and reinforcement. We also need to understand that there are problems that occur in our lap band patients. There are complications, surgical complications that are going to need surgical correction, and we need to understand how to identify them. We need to identify patient behaviours that are counterproductive and working against an optimal result. And we need to think about the patient's physical and psychological comorbidity. All of these can have an influence on the ultimate outcome. We need also to be able to understand why our patients are failing and provide our failing patients with a program of assistance and assessment so that we know that we're getting the best out of those that are struggling. Appropriate detection of patients that are lost to follow-up and a way of minimising that loss to follow-up is also important. When we look at the requirements of lap band follow-up, we see a range of requirements in this figure. We see adjustments in the centre, but adjustments are just one of the things that need following. Complications, assessing eating behaviour, looking for problematic behaviours, nutritional support, physical activity, dietary assessment and advice. All of these are required for every bariatric surgical patient in long-term follow-up. When we look at the importance of follow-up, this particular study was done in the United States where we looked at what people in the various practices thought was important to the long-term success of patients, and we looked at surgeons, physician extenders, program coordinators, dietitians, and you can see that they had very different views on what was important. The one thing that they were consistent with was that follow-up was important. They felt consistently that patient commitment was important, but it's interesting how really only surgeons thought the surgery was important and that adjustments were important. Now, we understand that we're not going to get success with the band unless we have adjustments and unless we have the surgery. So we have to have the whole team on the one page, understanding what can be put together to produce an excellent result. Of course the surgery has to be right, of course the adjustments have to be right, and on the other hand, we also need to know that we need a committed team to encourage and influence that compliance. When we look back at type 2 diabetes, we see that we've got a system in place and we struggle to provide the infrastructure to do that. We have no surgical models of bariatric care that are truly successful. And we need to integrate this with the community and primary care. In fact, what we lack in our community is the ability to provide bariatric care for this group. So what are the characteristics, in my view, of a successful team? They'll provide great care, they'll provide great follow-up. The patient will feel welcome. They find the interaction with the multidisciplinary team valuable. The team will provide a clear message, a consistent message and consistent direction. Everyone needs to be on exactly the same page. People will pick up inconsistencies immediately. If a patient with diabetes is going on to insulin, unless the whole team wants that patient and urges that patient to go onto insulin, that won't happen. They won't be keen on it. So our team's education, understanding, empathy with the patients is critical for excellent outcomes.